That if you can. Now, Dr. Sue Thomas is my next guest. She's started her own charity to help people in Ethiopia called For-ethiopia, and she's rushing off there this evening. I'm delighted to say she's taken a bit of time to come and see us first, in between trying to lose 3 kilograms from her baggage. What's your baggage allowance, Sue? What are you allowed?
It's a huge baggage allowance, 23-kilogram cases and 8 kilos in your hand luggage. You can barely carry it.
And how much have you got to lose of that? How much are you over at the moment?
I think some chocolates are going to have to go.
Some chocolates and the tea's made. So tell us about, you're a retired GP working here in Bristol?
I was in Bristol. I worked at Bradgate Surgery in Brentry.
OK, and when did you develop connections with Ethiopia? Well,
I first went to Ethiopia as a tourist in 2005, and there was a friend of mine who lives in Bristol, an Ethiopian national, and she was in the country at that time, and I knew she actually was the one that started the charity. And I knew she had something going on in a part of rural Ethiopia, a village to the west of Addis Ababa. And I asked if I could go and see it. And she took me out. At that time, she was mostly concerned with water supplies, building wells, capping springs, and education. And my interest was in primary health care. So while she was doing her water and education stuff, she left me at a clinic with a nurse. At least I thought she was a nurse. And you could have a conversation here. There are about 84 languages in Ethiopia, but English is the one they use for higher training. So you could have a conversation. And I was talking to this nurse and said, been very interesting. You keep everything spotlessly clean. I mean, she had a little box of a room no bigger than the studio, and there were lights in it but no electricity. There was a tap but no water, but everything was spotlessly clean. And I said, and how many people are you looking after at this clinic? And she said 7,000. And I was
just her.
I immediately thought, I mean, it was about what our list size was at the time, and I thought of all the GPs and the nurses and the admin staff and the district nurses. And I said, yes, and who's on your team? And she sort of went blank. And she said, well, the midwife might come if I need her. And that was it.
Wow.
I mean, I subsequently learned that these people here, they don't have a full nursing training. To become a health extension worker, they have about 9-10 months training. And then they're out at these rural clinics on their own, no backup. I mean, there isn't even a doctor in the county in which they're working, so it's a population of 150,000. Okay. And there'll be a couple of dozen of these rural health posts with these young women carrying the burden of the care.
So you saw this very obvious problem. What made you think that you could do something to help fix it?
Not fix it, but help. But help because I had a direct link, because Tigist had already started the charity, and we had a sister organisation already set up. So we could do things in Bristol, raise money, raise awareness, and we knew exactly where it was going and the people it was going to help and what they needed. We asked them, and participation is one of the big buzzwords. I'm quite new to sort of NGO type work, but we don't go and say, oh, you need this, you need that, here you are. We say, what do you want, what do you need? And we try and help. I mean, they know we're not very big.
So what have you managed to help with so far?
Well, I'll stick to the medical side because I could talk forever and I've only a few minutes. But to begin with, we asked what they wanted, and one of the nurses said, could I have a curtain to put on the window so I don't get burned when I'm doing my vaccinations? You know, their requests are as simple as that. Maybe tables, chairs, and examination.
But these things do make a huge difference.
They make a huge difference. But I guess the most exciting thing that we do are fridges.
For vaccines?
For vaccines. And initially, there were very few options. There's some electricity in the sort of county town, as it were, but out in the sticks there's nothing. So we were supplying kerosene fridges. And on one of my visits, I saw a fridge, and it wasn't working. And it's obvious they've no money to budget for the kerosene. Even if they have, some poor girl has got to walk 15-20 to carry the cans to and fro. So the kerosene fridges were not a success. And about the same time, a local firm in Bristol, a solar firm, picked up on us.
Wow.
And
I can
3 years ago, 3 years ago, we got our first solar fridge in a remote village called Besso. A couple of guys, we bought the fridge, and Solar Sense sent 2 operatives out, and they fixed the fridge. And year 2, wonderful, 3 more, and this year 3 more.
So in terms of the health benefits, how many children die of communicable diseases that we could vaccinate against in Ethiopia?
Don't ask me figures, but they said that the whole population have the same sort of jabs as we have here, the triple vaccine and the rest of it. But it's a question of getting it to them, and there's tremendous wastage of vaccine up until now, and that's one of the main the main delights of the solar fridge, that we're not wasting vaccines anymore. Certainly, if you look at the statistics, what people die of, it's your upper respiratory tract infections, your chest infections, diarrhea, vomiting. It's the basic things. I mean, malaria is there, but it's the simple measles. They're all the same things.
So what are you going to do as you go out this time? What's your project for?
Oh, right. Well, this is a very exciting visit, because for the first time I've got a colleague going along with me, another Bristol GP who's still actually practicing.
Okay.
And she's coming, Naomi Gillingham, she's coming primarily to observe, but as soon as they knew we were coming out, they're asking us for training. And Naomi has done some training in Nepal before with health extension workers. So I think we're going to have 2 days. I think they're going to bring in all these girls from the remote clinics, and we're going to do some basic training for them.
Wow, how wonderful, how exciting. Well, perhaps when you've done this, you can come back and tell us. Maybe you and Naomi could come into the studio and tell us how you got on and whether you managed to train them up. Isn't it wonderful? And given that they have nothing, are they fairly happy and positive, the people you've met in Ethiopia?
Oh, they're lovely. Yeah. Yes, they certainly are. And it's one of the things that I really felt strongly about the first time I went out. Your patients, they think things are bad. They don't know they're born compared to these people in Ethiopia. There's no safety net for them out there. Every little really does help.
And if people want to find out about your charity, what do they need to do?
They can go on the website, www.for-ethiopia.com.
Okay.
Or I'll come back and tell you about it.
Do both. For-ethiopia.com is the website, and Sue and possibly Naomi will come back after the visit and tell us how they get on. That's a really uplifting story. Thank you so much for taking the time to come in and see us. Dr. Sue Thomas, safe trip. Good luck getting your baggage down to normal.